Hi there. Thank you for joining UnSCRIPted. I'm Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at the school, all working toward a shared goal of solving the world's most pressing healthcare challenges. I'm excited for you to hear unscripted stories of faculty, staff, students, alums, and partners. Today, I have invited Representative Sasser from North Carolina's 67th District to my office for a conversation. Welcome, and thank you for joining me today, Representative.
Thank you, Dean. Nice to be here.
So you are the only pharmacist in our legislature.
Yes, ma'am. 170 members.
How about that? And so tell me about that experience of being a pharmacist and educating on pharmacy or on health issues in the legislature.
Well, not having, of course, if you work in a drugstore, you don't have a lot of free time to be on. I've been on some boards and that stuff, but never ran for public office because of the time issue. So I was really surprised when I got to Raleigh how easy it was to have a slot to fit into. I mean, just immediately was a chair of health. Didn't take long till I was a chair on insurance, and then it didn't take long, like 4 years, and then I was a big appropriations chair. So some people go down there and spend 10, 15 years and never get to be a chair of a committee, but having some expertise, especially in the medical field, it was an easy transition, they were. I was welcomed being the only pharmacist.
So you were an independent community pharmacy owner, pharmacies, I should say.
Correct.
You owned multiple pharmacies.
Yes, ma'am.
Can you talk about the pharmacist's role in an independent pharmacy in the community and why that's important?
Well, it's, I guess you'd say, a match made in heaven. Okay. We have the opportunity, and I think we embellish that opportunity to actually work with patients. We value our patients, and they value independent pharmacy. Just little things like, if you call a prescription in, you can basically get in your car and head on down and pick it up. If you call it in, and I'm not going to call any chain names, but if you call it in at Chains and they tell you on the phone, you can pick it up in 2 days. So, and we triage, our prescriptions and our patients. If you walk in the door, you go to the front of the line, not to the back of the line. And so it's just a great opportunity to be involved in your community and be involved in people's health care. Well, one good thing about pharmacy is it's never monotonous. It's never boring. It's not making widgets.
Yes.
Every day is a different day.
Yeah, that's terrific. As an independent pharmacy owner in rural communities, can you talk about the rural healthcare and the importance of pharmacies in rural communities as well?
Well, you when you go to the big cities, the big metropolis, then you see a drugstore on every corner, and some corners got two because what's Charlotte got 750,000 people in it or something, and they're chasing the money. When you go to rural America, there's always some health professional in every county, and we're accessible. You can walk in and talk to us anytime. You don't have to make an appointment, and we'll see you in 2 weeks for 15 minutes. So pharmacy's still accessible and available to people, and that's important.
Yeah, being that front door to health, particularly in areas that may not have a hospital, may not have a clinic, and most people, I think, across the U.S. are within 5 or 10 miles of a pharmacy.
Exactly.
And so critically important to be part of those communities. Yeah. I'm interested in your upbringing and what brought you to the pharmacy profession. Can you talk about that?
I would say mine's probably not traditional, but then all of us are individuals. None of us
Mm-hmm.
are traditional, and none of us fit in a box. So, no, I was raised in the country. Went to a little small elementary school. May have had 250 people in it. And then when I got ready to go to college in 1968, you can do the math on that. Actually got accepted at Carolina. Had no idea what I wanted to do.
Yeah.
Wasn't sure I was ready for big time Chapel Hill, so I ended up going to Western Carolina, up in the hills,
Yeah.
and loved it. Fantastic university, fantastic experience. Was a history major, which I'm kind of still a history buff. I couldn't figure out how, to make a living being a history major, so decided to go to pharmacy school. But it's just been a great experience. I mean, you have opportunity to help people. My youngest son's a pharmacist, and my youngest daughter-in-law is a pharmacist who just happens to teach here at pharmacy school. So pharmacy's been good to me.
Yeah. Well, so let's talk about the legislature, and what was your impetus or spark to run for office?
Well, I never had any intention getting in politics. There was just happened to be a situation in our county that the representation we had in that county was not very effective. So some people, came and talked to me. We need to get you to run. I said, who would have that job? I mean, that's what I sincerely thought. And so I didn't run that 2 years. It's a 2-year cycle. And so the next year, things had gotten worse instead of better. And so they came and talked to me again. And I said, yeah, I reckon I'll do it. So it was kind of interesting when I signed up to run, or started talking about running. The guy that was our representative at that time came and talked to me, and he said, you tell me what you want done and I'll get it done for you, and you don't have to run. I said, nah, I kind of believe I'll do it myself. And he said, well, you know that I've had somebody to run against me every time, and he'd been elected 5 times. He said, somebody's run against me every time, and nobody's ever even come close. I said, well, yeah, but you hadn't run against me yet. So as we do in the drugstore business, I worked hard, every day.
What have been your most critical issues or your most pressing issues that you've been trying to move forward?
Of course, initially started working on PBM Bill, and when I got down there 5 years ago, there wasn't one person out of the 170 that knew what PBM was. And I bet you 90% of them know now. They come up to me and want to talk about the PBM Bill.
Okay.
And so we did pass a really strong PBM Bill, which will actually help pharmacies and take, the money that the PBMs are profiting by, and all they do is run a computer and put it back in the drugstore for the people that are working with the patients and for the patients. And the bill's kind of hung up in the Senate, so we'll see what happens in the short session.
Okay. Can you talk about the STOP Act?
Yep. Yeah. We, and I'll regress back just a little bit, and somewhat got thrown under the bus in my county for passing Medicaid expansion. But Medicaid expansion, without a doubt, was the right thing to do. Not one thing we did with Medicaid expansion causes any taxpayer in this state to pay one extra dime.
Yes.
You got to figure out which is the cart and which is the horse. You can't get the cart in front of the horse. So Medicaid expansion was the first thing that we needed to do. Now we need to expand scope of practice because we don't have enough providers to take care of all these people. And then the second thing, where you bring it up or not, we're going to talk about it a little bit, is CON, Certificate of Needs.
Okay.
But we'll talk about the STOP Act, and it is just very simple. It means scope of practice. We just want to do health care.
Right.
You come to me and as a pharmacist and tell me you've got blood pressure problems, the doctors put me on this medicine, and you and I are going to work, together to make sure that your blood pressure gets treated. When it gets out of whack, you can call me instantly, or at least, that day, and we'll talk about where we need to increase the dose, where we need to talk to the doctor and see if we can get a, fluid pill added to, depends on where it's systolic or diastolic. And same way with diabetes. I mean, there's those things the pharmacist can treat better than the doctor because we're available.
Yes.
Okay.
Yeah.
15 minutes every 3 months or 6 months is not treating your illness.
Yeah.
And
no, people really need continuity of care. They need to be able to see someone once a month, every couple of weeks if they need.
It's availability.
Yeah, it really is. And it's part of a team.
I'm not bashing doctors. Don't
think
I am, because they're overworked. I mean, they don't have a life.
Yeah.
But we need to take
team-based care.
We need to take some of that pressure off of them and do the stuff that we're trained to do, taught to do, know how to do, and do better.
Right. Yeah, absolutely. So how do we encourage that next generation to go into politics, to represent their communities?
Well, and we need a diverse group of people. So don't think that, well, I'm not a lawyer, so I'm not going down to help pass laws. We got plenty of lawyers down there, okay? But there's a really need for those people. And
what's the most rewarding part of this job?
When you get to help people.
Okay.
Yeah. I mean, it's and just I've lived a blessed life. As we talked about coming off the farm, and we were poor, but everybody else was poor, so we didn't know we were poor. But you get down there and you really can help people.
Yeah, it goes back to the heart of the pharmacist.
Well, it's the reason we do this.
Yeah.
Okay.
Well, Representative Sasser, thank you so much for your time. Thank you for your service to your community and to North Carolina at large. We appreciate you.
Thank you.
And thank you for watching. We love sharing stories of those who make the UNC Eshelman School of Pharmacy excellent. We hope you will join us for the next episode of UnSCRIPted, conversations with the people who are advancing medicine for life.